Dr. Foote is co-founder of the Center for Motivation and Change, located in Manhattan and the Berkshires. He's nationally recognized as a clinical research scientist who's received federal grant funding for his work on motivational treatment approaches and substance use treatment research, focused on implementation of evidence-based treatments. He was also a psychologist for the New York Mets for 11 years and continues in sports psychology as an independent consultant to professional athletes. So hopefully we'll get a little bit more sports talk for those that like that. Before co-founding the Center for Motivation Change in 2003, Dr. Foote was Deputy Director in the Division of Alcohol Treatment Research at Mount Sinai in New York City and Senior Research Associate at the National Center on Addiction and Substance Use at Columbia University. He's co-author of the award-winning book, Beyond Addiction, How Science and Kindness Help People Change, a practical guide for families dealing with addiction and substance use problems based on the principles of community reinforcement and family training, CRAFT. And he's also the contributor of 2, and it maybe seems like 3 now, Dr. Foote, workbooks combining strategies of CRAFT and motivational interviewing. No, you're almost 3. So he's got one for the parents' 20-minute guide and the partner's 20-minute guide, which offers specific tools and practice and evidence-based strategies for helping a loved one change.
Thanks for having me, Dr. Croft. I was excited about coming out there last April, which didn't work out too well, and maybe fingers crossed next April. But for now, this is great, and appreciate getting to talk to you, all you guys. As Dr. Croft mentioned, I'm a clinical psychologist. I've been in addiction treatment and research and administration for about 30 years, and love what I do. I'm embarrassed to say that after many years of being in this field, kind of realized for a variety of reasons that I was not really in all of this addiction work, was not dealing with families. And I'm running treatment programs and so forth, and we have family programs and departments and everything else, and we had CRAFT training, and but deal with it in the sense of realizing the sort of the centrality of families to the change process, and what a resource that was not being utilized. So in terms of effectiveness of change processes, and as a humanitarian idea, to be leaving families out was kind of a terrible thing to do. And it started to sort of hit home with me more like probably 7-8 years ago, when I started to get calls like this, which I got randomly one day as I was exercising on a weekend. And I picked up the phone, and it was a fellow who was a New York City cop, and he had gotten my number somehow, and this is what he said to me. And I actually use this slide in training many times because there's so much information on this slide for examination of what does evidence-based treatment mean, and why are these questions even being asked, and how are these things even happening that are being described by this poor guy. But that's for another time. Mostly I'm using it now to say this is kind of my stats sheet slides at the moment, instead of 6 slides about prevalence and overdose rates and regions of the country and treatment. This is sort of the thing that feels like it is the main point for me, and what kind of made me say we have to actually change what we're doing, and we have to actually think about helping in a different So we started a foundation. As I said, we have, and as Dr. Croft said, we have several treatment centers and residential program, outpatient programs and stuff, but those were not doing what we wanted to do. And interestingly, I think our mission is overlapping a lot with the mission that you just walked through, which is to really try to do something different, and motivate a different group of people, and bring in a different sort of army of people to help. Because if you sort of step back and think about who we are as professionals and the number of people that are involved in substance use issues, the number of professionals involved is nothing compared to the number of people struggling and suffering with this. So that is what our foundation was set up for, to disseminate evidence-based tools and ideas to families. And that's a whole nother discussion about how we're doing that in terms of community training and setting up peer coaching networks and so forth, whether that's in person or phone coaching, this kind of stuff, but also to provide the content for people because they really don't have that. So I will go through a couple of data slides in terms of why does it matter that we actually want to involve families in addition to just the compassionate idea that there are huge numbers of people suffering and who have no idea what to do. If you look at how we're helping the person who's struggling with substances themselves, what you find out is that nobody's getting treatment. So this is these numbers are percentages of people not in treatment when you just look at people who have substance use disorder. So this is not like that other 40 million people in the country who have real substance use issues, but don't qualify in terms of DSM diagnostic criteria. This is the people who meet substance use disorder criteria who are not in treatment. And the numbers here are in the 70, 80, almost over 90% zone. Then to continue this little grim walk, when you look at people, what kind of treatment they're getting, those small numbers of people, what they're typically getting is a big dollop of 12-step oriented either treatment or self-help referral, a smattering of outpatient treatment, a lot of primary care docs stepping up and doing good work and actually talking to their clients about this kind of stuff, which is awesome. And very little family services here either in terms of actual professional care being provided. When you look at what we're doing as treatment professionals, you find, and there's been a number of surveys, and some of you may be familiar with certain treatment program surveys about what are you all doing over there? Are you doing anything evidence-based? Are you doing something called CBT, that crazy treatment, or MI, or contingency management, or the last one is brief strategic family therapy? And what you find if you ask program administrators is, the answer is, yes, of course we are. Why, we had an in-service on that just last week. And that's the last you'll hear of it from our trainers. So the numbers go from, we use this treatment, when you say, okay, did you actually get any formal training? You see the numbers dropping dramatically. And then if you say, do you supervise people on that with people who've been trained as supervisors, then the numbers are really low. And then the sort of the gold standard of research would be, we do tape review of the work you're doing. And that just essentially doesn't happen. And for all kinds of reasons, it makes sense as well. But if you step back up to just the level of supervised training or formal supervised training of the cases or formal, even just formal training, once you get beyond CBT, which is a pretty big category, stuff like motivational interviewing gets in the lower numbers, and contingency management is really down there, and family stuff, forget about it. Just to indict my own world of psychologists, if you look, this is a much more recent one. I think this is, what is that, 2017. John Norcross and his colleagues periodically do reviews with graduate programs about how are we doing with addiction training stuff there. And you ask these kind of questions like, are there specific clinical sites in your 6 years of training having to do with addiction? And it's in the 30% zone. Any of your faculty interested in this? Below half, and in PsyD programs below 20%, and not much research involvement. So those are all not awesome things. So then if you go back to the question of, well, how are we going to help people? Because we're not training people very well, we're not providing much treatment. That was when we sort of had the thought, like, okay, we have this incredibly motivated group of people, which is families. And they couldn't be more motivated. Like, they're desperate for help. They're desperate to help their loved ones. And when you look at those numbers and you think people meeting substance abuse disorder criteria are, on the order of 20 million people in the country, 25 million people, then you look at the number of people impacted by that, and you just have this giant multiple to get you in the 60 to 100 million people, kind of like everybody knows somebody kind of thing. And the impact on those people is enormous. And as anyone here who's working in substance use disorder land knows, you see it every day in your office when you're talking to people, the family members, and the number of studies about decreased productivity, health problems, stress, all this kind of stuff. The thing that we also focus a lot on is just this going underground thing, the kind of isolating aspects of substance use disorder, that the families are just suffering and really don't have anywhere to go, and really get the message from the culture that you probably shouldn't talk about this stuff. So this is the kind of recommendation they do get, though, if they sort of dare to step out. And these would be sort of the top of the list of things that people would hear. You can go to self-help, Al-Anon kind of stuff. You can do an intervention, or you can step away from them. All of those have to do with taking care of yourself in some sense and letting them hit bottom, letting them do this thing, do their own thing, which, if we're talking about evidence-based ideas, we know are not effective ways to approach someone. The other thing that happens for people is they are confronted with the language of the culture. And that language is not pretty language, and is language that would also keep them from actually stepping out and asking for help. So I'm gonna play this for you. This is a little video we made just to talk about the language. Maybe take 42 seconds to see if anybody has any reaction to that. Any thought about that?
Oh my gosh, I watched that last night. It was wonderful. It's beautifully done. Oh my gosh, thank you.
My first initial feeling, I mean, is emotion. I'm a parent and it hurts, those names and the separation, but it's such a positive. I mean, there is hope. And that's the message I agree. Thank you so much.
You're welcome.
Yeah, I work with families in a recovery community outreach center. And this is one of the biggest things I work on is changing the language from that negative stigmatic language that is out there to a message of hope and inspiration. And you know, when we talk to people like they're actually humans and instead of labeling them, it makes such a huge difference.
Yeah.
This is a great video.
Thanks. Yep. Yep. And it makes a huge difference as a human being. And we know from the data and the evidence from research studies that it makes a huge difference also. The language actually matters. And again, if you're a parent, if you're a family member, if you're a spouse, if you're trying to help somebody who's wants to be helped, doesn't want to be helped, all the whole spectrum, and you step into the culture, that first half of that video is what you get still. You know, that's predominantly what you get still. And I wish that weren't true. And I'm not being cynical. It's like it's just reality. Like that's what actually people get. And it's like a punch in the face. And who wants to step into that? And who's going to feel hopeful if they step into that either?
Yeah, and when families attend like Nar-Anon or Al-Anon meetings, you know, they refer to them as this is my addict or my alcoholic. It's like, no, it's your husband, it's your wife, it's your son, it's your daughter, not your addict.
Yep. And again, it's in the culture. So, you know, people are desperate for tools and you give them those tools and that's what they'll use. And of course they will, because they want to help. But the messaging here, which is this kind of language too, you know, how many people have come across our door and said, we call this treatment trauma actually at this point. It's like, this is what treatment providers always tell me. You know, this is what they said at the program I sent my son to. You know, because my son is struggling, I must be enabling him, or I must be codependent, or all these other labels that are not terms that are particularly helpful. They're actually just sort of like almost like curse words at this point for lots of people. And the messaging is that's what families come away with. We blew it somehow. We were too strict, we weren't too strict, we were too involved, we weren't involved enough, and you could make this list like 100 items long. That stigma has an impact. It's one of the main reasons that people don't look for help. It's one of the main reasons that families don't look for help. And it's one of the main reasons that families feel like they're responsible for these problems, which is a anti-motivational message to give someone who was trying to help another person. I'm holding you responsible for their problems. Okay, I don't really want to help anymore because this is not a good place to be. Which, you know, the shame of that is that there's been some surveys showing that the leading cause of seeking treatment is my loved one wanted me to. Which we can say, you know, you need to be motivated for yourself, but look, if that's going to help you decide to get some help, that's awesome. So shouldn't we be helping families open those doors in more accessible ways that are more encouraging for their loved ones? So that's where we started in terms of this foundation. And that's where we started in terms of trying to develop some ideas that would be helpful for addressing families directly and really testing out these tools. So over the last 7 or 8 years, we've been doing a variety of trainings for peer coaching around the country. That's sort of the format that is taken, and trained, you know, hundreds of parents to be peer coaches to other parents, and done this in all these hotspots around the country. Some of this was like DEA funded for opiate hotspots and this kind of thing. But really tried to come up with a model that was utilizing evidence-based ideas and strategies, but had this iterative process where we kept feeding it back to the parents and the coaches we were training to see what was sticking, to see what was useful to them, to see what actually made sense to them, and to try to actually hand over ideas in a way that would make sense to people, not that were just good scientific ideas that we pulled off our journal shelf and tried to explain, but we actually tried to do the work of making this accessible for people. And so the model now is something we started out with craft, and then through this work over a number of years, just kept needing to pull in other elements that we felt like were really critical to help people help. So craft is a great core behavioral, semi-motivational model, but we really ended up wanting to bring in a bunch of motivational interviewing stuff, and more recently in the last 3-4 years, bringing in a bunch of stuff from ACT. And I'm not going to go through it all today because we don't have enough time, but the idea is sort of this science and kindness idea of, can we take evidence-based principles and practices, and can we combine that with some compassion? Now, compassion turns out is an evidence-based principle also. So you get a twofer out of that one. But that's been the idea in terms of developing this model. And instead of calling it craft anymore, at some point we couldn't because it didn't make sense. It's not really craft. It's craft and MI and ACT and other stuff. So we are calling this the invitation to change. And we have also, as part of the accessibility issue, I've tried to make this a easily understandable thing. You might look at this circle and go, that's insanely badly done. What are you talking about? That's not accessible. But you'd be wrong. No. But so the idea is to have this idea of a visual that people can kind of grasp onto with some ideas that are things people can get in a sort of a common sense kind of way. There's really three major segments of this approach, and we describe each of these as helping with. So what are the components of helping? What are the most effective arenas in which you can learn something new to be a helper to someone else? So there's helping with understanding, helping with awareness, and helping with action tools. This crowd here of professionals probably is very familiar with the action tools, which we will not get into today, which are really essentially communication strategies, largely drawn from craft and motivational interviewing, and behavioral reinforcement strategies. And those are straightforward CBT things. They're incredibly powerful tools. What we have come to understand over time in training people is if we can't help shift your perspective with this understanding stuff, and if we can't help you become part of the change process through awareness of yourself in ways that I'll describe a little bit later, your ability to use those tools and your effectiveness as a tool holder is really diminished. So like you can go buy a CBT workbook about how to talk to your kid, and that's helpful. Having a different understanding of what the heck is going on here and having a different level of awareness of yourself in this process are pretty critical for using those tools well. So this first section, which is the yellow one, helping with understanding, I think of as kind of the foundational thing. And it is about the perspective shift that we hope people can make. It can seem pretty straightforward. It is kind of straightforward, as you'll see in a second. And it's kind of foundationally shifting for many people, especially when you come from the cultural influences that we just walked through in terms of the languaging and the way people view this and the stigma around substance use. This way of thinking about it is actually quite different for people when they're coming from that perspective. If you were a behavioral scientist, this is like, oh, that's easy. Of course that makes sense. That, you know, of course that's what it is. If you're living in our culture and your kid is struggling with opiates, that's not how you're hearing things, and that's not what you've been told. So there's three parts of this helping with understanding section. I'll walk through them. And behaviors make sense is the first part of that. Again, some of the visuals, the idea, again, as a way to kind of simply grasp this, that if using substances was like touching a hot stove, your loved one would have stopped already. That's our way of saying it makes sense to them. You don't touch hot stoves anymore because it doesn't make any sense. There's nothing reinforcing about touching a hot stove. And people don't do it more than once. But people do use substances many more times than once. And that's the difference. On a purely behavioral level, there's something about this that really works for me. And that's why I keep doing it, okay? Another way we try to walk through this, so I'm not gonna walk through a couple of ways we try to then explain this idea to people so they can get their heads around it. Because as you might imagine, and as you might have dealt with many people, if you have tried to have any discussion like this with a client or a family member, what do you mean? The response is, what do you mean? It's crazy. This doesn't make sense. You know how dangerous this is? And holding these two ideas at the same time can be difficult for people. So those can both be true. It is, you could describe it as incredibly destructive. Yeah, that's why we're hoping this will change. It doesn't mean it doesn't make sense. And it doesn't mean it's not reinforcing. It is. So we walk through this exercise. If I told you I could help you with all these things, if I could help you mellow out, feel less depressed, feel good, take away your boredom, help you with your bad physical pain, get you excited, help you socialize, let you feel part of something instead of feeling lonely, help you focus, help you lose weight, cut your anxiety down, make you a really funny person, help you appreciate other people, get some sleep because you have horrible insomnia, help you get out of bed in the morning and face the day instead of not. So the question there always is there anything wrong with these goals? The answer is, of course not. Anybody wants this. And for some people, they want everything on this list desperately. For some people, they're pretty good. A couple of these things would be nice to have. Yeah, that would be great. For some people, being able to achieve some of these things would be life altering. You're telling me I can help alleviate my physical pain, that would change my whole life. You can telling me I can sleep better, that would change my whole life. So then when you go to this one and you say, so these are substance use reasons that make sense for people. It's the same list. Is there anything wrong with these goals? No, of course not. There's nothing wrong with the goals. What we are introducing is our strategy for achieving these goals is now called heroin. Our strategy for achieving these goals is now called alcohol. That's the part you don't like. That's the part that's causing problems. But it's not the fact that I want these things. And when I drink, it does these things for me. And that's massively reinforcing for me as a person. And there's nothing wrong with the fact that that's reinforcing. Of course it is. So if you can get what I'm saying here, one of the things that starts to happen is this starts to destigmatize the act that's occurring. Right? I'm choosing to do this behavior because I'm getting these things and these things really matter. And there's nothing crazy about that. This is a little proverb that many people relate to, especially when they go into treatment programs that don't want to talk about their thirst, they just want to talk about their drinking. And then there's a video we developed, and this is part of our foundation work. We're trying to develop a lot of videos to help people in these training processes, like in community-based groups and so forth, so that communities can lead their own groups. It doesn't have to be done by professionals. So this is a training video to help drive home this same point.
Imagine this scenario. You're walking down the side of a two-way street when you look up and see a person trying to cross. There's plenty of traffic and you can hear cars and trucks whooshing by. The person you noticed looks impatient, upset, frantic, and does not seem to be considering the danger ahead of them. Instead, all they seem to be concerned about is getting to the other side of the street. Take a moment to consider the following. What are your thoughts and feelings about this person and their behavior? And what are some actions that those thoughts and feelings make you want to take? You may be thinking, what's wrong with them? What's making them crazy enough to try and cross traffic without thinking? Are they dangerous? You may be feeling scared for what's about to happen, anxious for the person you're watching, and confused by their behavior. Some actions you may want to consider include moving away from the situation by leaving so you don't have to see the person get hurt, or engaging in the situation by yelling at them to stop to try to promote a positive outcome. Continue imagining the same scenario, only now I'll give you a little bit more information. Before you saw this person, they had been driving further down the road with their dog in the back seat. At a stoplight, the dog jumped out of the car and began running through traffic. The person is now frantically trying to get the dog back inside of the car before it gets hurt. Now take a moment to consider the following. What are your thoughts and feelings about this person after learning about their reason for trying to cross such a busy street? What are some actions those thoughts and feelings make you want to take? You might be thinking, how can I help this person? How do I keep him safe when he's upset and not thinking about his own safety? You might be feeling compassion, sadness for the person's situation, and fear it might go badly. You may be more inclined to take action by offering to help, calling for more help, or trying to intervene in some way. The purpose of this exercise is to show that when another person's behavior seems irrational or erratic or scary in some way, in the way that substance use often does, it can push us into a let me get away from this or make it stop response, and make us want to move away from it entirely. It can be hard to see how to be helpful in these situations or to even want to help, while also experiencing our own set of thoughts and emotions as a bystander. By taking a moment to put the behaviors into a larger context, By understanding the why behind their behavior, we can start to make sense of the motivation behind them. We can then decide on a productive way to move forward. So let's think back to the scenario we just imagined. If we start off deciding that the person running in the road is doing it just because they're crazy, then we are also limiting ourselves from seeing the full picture. This way of thinking is natural, but does not facilitate positive action on our part. Instead, if we decide that the person trying to cross the road has a valid or a sympathetic reason for their behavior, we open ourselves up to more understanding. We can now accept new information and learn that the person is trying to find their dog. This information will most likely shift our thoughts and emotions surrounding the behavior, and we'll then be able to come up with and want to come up with a productive plan on how to help them. Finally, let's put this all in the context of substance use. If we decide that a person who is using substances is doing so just because they are an addict, aka a morally bankrupt, irresponsible person, we will very effectively shut out information that could help us understand their behaviors. And without that understanding, we won't be able to find a constructive way to offer support. However, if we open ourselves up to understanding that all behaviors make sense, we will learn that people use substances for valid reasons. Examples could include using substances to ease anxiety, feel more ready to handle daily life, or get to sleep despite physical pain. This type of information will then help us begin moving forward by supporting our loved ones in a productive way.
Okay. Every time I see that dog in the road, it makes me want to cry. So hopefully that makes that the point is clear there. Is recontextualizing behavior and actually trying to help people understand that if they understand something about why that makes sense, their whole approach, their whole desire for connection, their whole desire to help shifts. So in terms of the helper then, if I'm talking this through with a family member, it's going to help them do stuff like not take that behavior as personally, which is going to help them increase their empathy instead of feeling hurt or angry. Empathy is going to lead to better collaboration. And it's also going to give them practical stuff like feeling like this is not just random, horrible, painful behavior, but stuff that makes sense to me. Yeah, this is that anxiety stuff again, or this is that desire for connection to other kids and the isolation that he's trying to get out of by smoking pot every night, which then offers you the chance to do strategic planning in terms of behavior change and substitutional behaviors and so forth. But that would be the tools at the bottom there is like, now we can do positive reinforcement stuff or, alternative activities to compete with the substance use. I'm not going to do any of that stuff if I don't stop taking it personally and start to have some sense of empathy for this whole process. And that's how they start to connect the tools on the bottom of that circle, the behavioral tools, with the understanding and the shift in my perspective on this whole thing. And then certainly the impact on the person that we're trying to help is them, their experience of feeling validated as a whole person. How many people in this room have sat and they walk in the door and say, I'm an addict, and yeah, I got to change, I got to get my shit together, and blah blah blah, and I want to stop. And no, you do want to stop, and you also don't want to stop. And we can actually talk about both of those sides. We don't have to pretend that there's only one side to this, and we're just trying to get quote bad behavior to go away. You're a human being. You're helping your anxiety with your pot smoking. I get it. What else can we do? Which will allow more openness and allow more consideration of change. So that's the whole point of that. The next two parts of this helping with understanding section are really flow directly out of that perspective shift of behaviors make sense. If I think that behaviors make sense, the next important question for me as a provider, as a family member is, in what way does it make sense? Because it really doesn't make sense in the same way for everybody. It makes sense in incredibly different ways for different people. So if we went back through that list of, if I could do this for you, I'm going to pick these three, then the guy next to me is going to pick those two that are not the same. Someone else is going to pick another two in that list. And someone else is going to pick everything on that list. And those are really different profiles of human beings in terms of how we're going to then help them. So behavior is complicated and complex. And if we can understand it in a more individualized way, we're much more likely to be able to offer a bunch of options more geared to that person, and they're much more likely to take those options. This is just a little visual for who walks in the door. So I'm 35, I'm 55, I'm 15, I have PTSD, I don't have PTSD, I'm super stressed, I'm using opiates, or I'm using cocaine, or I'm using pot. I've been using for 6 months or 15 years or 10 years. I've never been in therapy. I hate therapy because my parents make me go. I've been in 8 rehabs, okay? And we could have a list of 100 different people here and their profiles and what got them into substance use, and what might be a thing to help shift them out of that. And that's something that they would consider for them. Instead, we will say, yes, you should go to rehab. Well, really, I really shouldn't. Like, that's the worst possible place I could go. I really have bad social anxiety, and being in a rehab, I'm going to spend the whole time in my room holding my breath trying to get out of here. Or I shouldn't go to rehab because I'm going to resent it so badly that I will never go to treatment again after that rehab. Or I totally should go to rehab because I need a break from my life. It's going to just be different for different people. And that sort of like, no, you have this thing called addiction, so you should do this thing called rehab part is by definition stigmatizing. So when we don't do that, when we realize that one size doesn't fit all, we are actually opening up the possibilities for the possible routes out of there, and increasing the number of options that we have, and increasing our collaboration with that person. And collaboration with the person is sort of the bottom line. There's not much more that you could put on your wish list for how to help another person struggling with substances than that they want to be helped. If we got that, we have gone so far down the field to, 90 yards down the field. Speaking of sports analogies. So if you get to that place where you're saying, I know that this is not the same for everybody, how can I figure this out for my kid or my husband or my father? You can start to ask these kind of questions. What are some options for treatment that they might consider, and why would those things be helpful for them? And what resources do we have that have nothing to do with treatment, that are like, our places of worship or support groups in the community, or his uncle, or what other options we have besides rehab? We can also start to ask the question like, what new behaviors can replace the old? And that's when the behavioral work we would do comes in. And if I'm actually thinking that their behaviors make sense, and I know specifically some of the things that are hard for them or are related to their substance use, what will be hard for them about taking help? In this pathway that we're thinking about with them, what will be the stumbling blocks for that? Okay, so hopefully that makes sense. The first part about behaviors make sense leads into, and what way does it make sense? And then the last part about this idea of the behaviors make sense is this idea of ambivalence, and trying to normalize that, which is just enormously helpful for family members to realize that there's something called ambivalence, that people don't, it's not an on-off switch that gets flipped and they're ready to go and now they're ready for change and we're good. Like that constant back and forth, and then they relapsed, and then they said they were wanting to change and then they didn't, and all that kind of stuff is such difficult stuff for families. If we can help them go, that's what's gonna happen. Like, and that's not weird, and it's not abnormal, and they're not a liar, and they're not in denial. It's just hard to change. And there's reasons that they were doing the old behavior, right? And those didn't vanish. For those of you who I've been talking too much for you to get the joke here, purchase any 6 Lean Cuisine entrees in a single order and you receive a free 56-ounce container of ice cream. So this is a actual coupon that is the definition of ambivalence. I want 2 things. They seem to be diametrically opposed, and I still want both of them. Would anybody say that's bizarre that you want both of those? No, I like ice cream and I want to lose weight both. Those are both true. So being able to understand that ambivalence is part of this equation, and being able to start to read the other person and their process and how open they are to changing at any given moment is a really critical part of trying to help them. Another really critical part of this, and again, it's sort of a perspective shift for people, is you would wish that we could get them to change their behavior. But let's remember, there's this list of positives that don't go away. They still know that the alcohol is going to help mellow them out and help them feel good and take away their boredom. And even if we can get them to start doing these nice things on the other list on the right-hand side here, like yoga and listening to music and picking up new hobbies and meditating all the time, those are new behaviors. They're hard to do. They're unfamiliar, and people don't like new things. And they're not as good as alcohol, and it's going to take a while. So that's what ambivalence is. Yes, I would like to try those new things. And yes, I would like to drink because it helps me do all these other things still. Okay? Normalizing that for people just helps take the temperature down, and helps them think through this idea that it's going to take a while. So we have just a couple minutes before we can talk about some questions. But I'll just say very quickly in terms of this next section with helping with awareness, helping with understanding and helping with awareness. Another way I sometimes describe that is things I can do on the inside, which is understand this differently and be aware of myself. And then helping with action is things I can do on the outside. Like I can learn different way of speaking. I can learn about reinforcing positive behaviors and use of affirmations and these kind of things. And those are all very powerful tools. So those are sort of in the world with the person. These are things that are on my side of the street. Understanding this differently and being aware of myself, that's on my side of the street. And that's just in and of itself is a perspective shifter for people. Because again, the stimulus in the world is my kid is on fire and I have to change this. I'm not paying attention to myself. I'm not trying to understand this particularly. I just want to change this because it's scary. So this helping with awareness section has 3 parts also. And we really start with, you got to check in with yourself. You got to start to become aware of yourself. And what you're going to become aware of that we try to help them with is 2 main things. One is awareness of my feelings, thoughts, my body, my reactions to stuff. Again, stuff that is often just discarded and not thought through by anybody who's trying to help someone else. But start to get in touch with this stuff. And what you'll realize is there's a lot of stuff here that's painful, that's hard. It's not stuff you really want to think about. I am scared and angry and upset a lot. I am tense in my body. I am freaking out. I do shout a lot more at my kids than I want to. But the other part that we want them to become aware of is what do they value? What do they think about themselves as a person that's important to them, as a human and as a family member in these interactions? And ultimately what we try to get people to understand is those are 2 sides of a coin. And this is something we then talk about as willingness, okay? But 2 sides of the coin. There are things that are uncomfortable and are hard about this whole situation. And there are the things that you care about, that you want to be connected, you love your child, you want to feel like you can be a trustworthy connector for them. If you're going to hang in there and work with them on these things, it's going to be painful and uncomfortable. So to try to take this process from one where we're trying to make the pain go away and get back to like we used to have things and make them not be a drug addict anymore, and can't we just clean the slate and get back to the good stuff? The answer is no. The answer is this is hard, it's scary, it's painful, and you can do it, and you can hang in there, and you don't have to make the pain go away. And as a matter of fact, the pain is a clue about how much you care, and can be a clue about who you are as a person and how you want to behave. We sometimes do this exercise, which is, let's pretend it was your 80th birthday. How would you want your kid or your husband or whoever to look back on this period of time when you were trying to help them with their substance use issues? How would you like them to describe you and the impact you had on them and what qualities you brought to those moments in their life when they were having a really hard time? And it's a way to help people think through, well, I actually don't want to be the person who was screaming at them all the time and who didn't trust them and who kicked them out of the house and all that stuff, which again is what the culture told me to do, but that's not who I am. It's not what I want, actually. What we also know to be true is it's not that helpful. So can you find yourself as part of this self-awareness process and then bring that person to these helping strategies that we're trying to work on together? So the self-awareness section has, can I just check in with myself? Can I understand that the pain is going to go along for the ride here? And can I take care of myself? That's the third part, which is about self-compassion. And that's what we try to walk through in this section on on helping with awareness. And as I said at the beginning, the last part here of action, if I can understand that I'm part of this change process and sort of become aware of myself, and understand that this is going to be painful and it's okay. If I can understand that my child or husband is not a demon, but they're doing these things for reasons that make sense, that are very specific to them, then I can actually start to use these tools about communication and being more patient and being more affirmative and asking open-ended questions and using positive reinforcement for the small changes that they're making and learning how to set limits in a reasonable way. Those are all the action tools that are really, really helpful if they're imbued with these awareness and understanding here. The last thing I would say is we also talk a lot, and there's such good tools in that toolbox there, guys, sorry, is the idea of practice as a sort of an overarching concept, that this takes practice. For your loved one to change, it's going to take them practice to not smoke pot, but go to yoga instead. That's something they have to practice. For you to communicate in a more affirmative way, that's going to take practice, and you're going to not do it well sometimes. And can there be some compassion and some learning that is allowed in this whole change process? Because that's how everything has to change. People have to learn new things. The last thing I'll say about that is we sometimes encourage people to think about their favorite mentor in their life, a parent who is a mentor, a manager, a coach, a boss. What were the qualities of that person that helped you be productive, helped you be your best self, helped you feel good about yourself? And what are those qualities, and can you bring those to this equation of trying to help your loved one and trying to be patient with yourself in learning these new strategies? So that's what we're doing. That's what our foundation is trying to do. And we have some workbooks that we use, which we're updating, and we have Beyond Addiction, which is a book for families as well.